Hello and welcome back to the EquiHerbal podcast, where we discuss all things herbs and horses to help you and your horse live a happy, healthier life, naturally. I am Kayla Dendy, your Master Herbalist, and today I will be discussing Cascara Sagrada, a gentle, non-addictive laxative. As always, please speak with your doctor or veterinarian before utilizing herbs or alternative medicine. This podcast is for informational purposes only and is not intended or designed to be a substitute for qualified medical advice. Welcome to today's deep dive into one of the most historically significant remedies in North America, Cascara Sagrada. Known scientifically as Frangula persiana or Rhamnus persiana, this sacred bark, a name bestowed by Spanish and Mexican explorers in the 17th century, has a rich legacy that spans from indigenous traditional medicine to modern pharmaceutical use. Cascara Sagrada is a large shrub or small tree that typically grows between 15 and 40 feet tall, with a trunk measuring 18 to 20 inches in diameter. It is a perennial plant native to the moist coniferous forests and canyons of the Pacific Northwest and the Rocky Mountains of the United States. The exterior of the bark is light to dark brown or reddish gray and is often covered with silvery gray or whitish lichen patches and moss. Beneath the lichen, the cork is smooth and dark purplish brown, marked with lenticels, or linear marks. The inner surface is smooth with very fine longitudinal lines. It is yellowish when fresh but turns dark brown or black with age. The leaves of the tree or shrub are elliptical and range from 2 to 6 inches long and 1 to 3 inches wide. They feature finely saw-toothed margins and prominent subparallel veins that are very noticeable on the underside. While the tops are bright green, the undersides are often downy or pubescent, especially when the leaves are young. The flowers are small and greenish or white, appearing in clusters known as umbels after the leaves have matured. The plant produces a small black drupe or berry, roughly the size of a large pea, which contains 3 black shining seeds. Though birds and mammals eat them, the fruits are described as having an insipid or bland taste. The bark has a distinct leather-like odor and a persistently bitter, disagreeable taste. It contains a yellow pigment that will stain the saliva and any material it remains in contact with for an extended period of time. The tree's appearance can be thought of as a weathered stone wall covered in velvet. Its sturdy dark trunk is softened by a coat of silver lichen and moss, while its vibrant green leaves are etched with precise, orderly lines of a master architect. Cascara Sagrada has several sister plants within its botanical family and genus that share similar medicinal properties, but vary in their intensity. Its most direct relatives include purging buckthorn and alder buckthorn. Purging buckthorn is described as a more drastic sister of Cascara Sagrada, providing a more aggressive laxative effect. Alder buckthorn is known as a somewhat milder laxative than Cascara Sagrada. It contains a substance potentially identical to the amodin found in Cascara Sagrada bark. Cascara Sagrada belongs to a genus that includes over 20 species, many of which were traditionally respected by indigenous groups and early explorers for their medicinal value. Beyond the immediate relatives, Cascara Sagrada is part of a broader group of anthraquinone-containing botanicals used for their stimulant laxative effects. This laxative family includes senna, rhubarb root, specifically Turkey rhubarb, and aloe latex. Among these, Cascara Sagrada is noted for being one of the mildest options. For instance, it is considered much gentler than senna. While it is difficult to distinguish Cascara Sagrada from other similar species in the wild, its unique ability to tone the intestinal tract rather than just purging it distinguishes it from many of its more potent sisters. To put it in perspective, if the anthraquinone group were a team of athletes, senna and purging buckthorn would be the high-intensity sprinters that get results fast, but can be taxing, while Cascara Sagrada is the endurance coach, working more slowly to build the body's natural strength and rhythm over time. The primary part of Cascara Sagrada used medicinally is the dried bark, though other parts of the plant have historical and secondary applications. The bark is harvested from the trunks and large branches of the tree, usually between April and August when it separates most easily from the wood. It is considered the most medicinally virtuous part of the plant, but its use comes with a strict requirement for aging. Fresh bark is toxic and must never be used because it causes severe nausea, griping, and vomiting. To be safe for consumption, the bark must be dried and aged for at least 1 year. though 3 to 6 years is often recommended. During the aging process, the action of oxygen causes the active bitter principles to mellow, transforming the bark into a gentle but effective intestinal tonic and laxative. Once aged, the bark is processed into various preparations, including decoctions, fluid extracts, tinctures, powders, and even chocolate-coated tablets. While the bark is the standard in modern herbalism, other parts were significant in traditional practices. Native American tribes historically used the berries for medicinal purposes. The fruit is a small black drupe that contains 3 seeds. While the taste is described as bland, the berries were utilized as a laxative and emetic. In folk medicine, leaf extracts were occasionally used in herbal combinations to serve as a laxative. Even the flowers have a functional medicinal role. In certain regions, such as Sonoma, California, the small greenish-white flowers are a leading source of honey. This specific honey is noted for having a mildly laxative effect. To understand the necessity of aging the bark, you can think of it like a green banana compared to a ripe one. While the fruit is present in both, it is only after the ripening process of aging that the bark loses its harsh, bitter qualities and becomes beneficial for the system. The history of Cascara Sagrada is a journey from traditional indigenous knowledge to global pharmaceutical dominance. While it is a relatively new drug in modern medicine, its roots are deeply embedded in the ancient traditions of North America. For centuries, Native American tribes in the Pacific Northwest utilized the bark of this tree as a laxative and emetic, as well as a topical treatment for cuts and sores. In the 17th century, Spanish and Mexican explorers and priests in California were introduced to the herb by these indigenous groups. Intrigued by the natives' high respect for the plant's healing properties, the Spanish bestowed the name Cascara Sagrada, which translates to sacred bark. Historically, the plant was also known as chitum bark or chitum wood, though these names have largely become obsolete. In some traditions, it was even called Christ's thorn, arising from a legend that it was one of the species used to compose the crown of thorns. Cascara Sagrada's entry into Western medical practice occurred in the late 19th century. It was first introduced by Dr. J. H. Bundy, an eclectic physician, who published a paper in 1877 in the journal New Preparations. Dr. Bundy championed the bark as an exceptional remedy for constipation that worked by stimulating the sympathetic nervous system and the solar plexus. By the time the 19th edition of the United States Dispensatory was published, even conventional medical doctors recognized the bark's ability to produce permanent beneficial effects on the intestinal tract. Renowned herbalists, such as Dr. Shook, utilized the herb for over 30 years, finding it effective for patients who had suffered from chronic constipation for decades. The use of Cascara Sagrada eventually spread worldwide. In Russia and Siberia, it became known as Krishna or Joster. At the height of its popularity, it was one of the most widely used laxatives in the world, with over 5 million pounds of bark processed in a single year. In the modern era, the herb has received formal recognition from several international bodies. It was approved for use in constipation by the German Commission E, and it is the subject of monographs by the World Health Organization, WHO, and the British Herbal Medical Association. Despite this long history of use, Cascara Sagrada was eventually banned as an over-the-counter drug ingredient, though it remains in demand and is still sold today as a dietary supplement. The plant's commercial success led to significant environmental consequences. Historically, collectors would peel the bark so extensively that the trees could not recover, leading to the destruction of approximately 100,000 trees annually to meet global demand. This legacy of overharvesting has made modern conservation efforts essential to protect the species in its native habitat. While Cascara Sagrada is most famous for its medicinal properties, it has several practical uses in the dye, food, and honey industries, as well as its role in the ecosystem. The bark, which is sometimes referred to as chitum wood, serves as a source for dyes. It can produce a variety of colors, including dark yellow tan, browns, tans, and gray. The bark's ability to stain is so strong that it can turn saliva yellow and will stain almost anything it remains in contact with for an extended period. The plant has several applications in the commercial food industry. Bitter Cascara Sagrada extracts are used in the production of liquors, while debittered extracts are used as flavoring agents in soft drinks, ice cream, and various baked goods. The small black berries can be eaten raw or cooked. However, Eating them in excess may cause the skin to temporarily take on a reddish tint. In Sonoma, California, the flowers are a leading source for honey. This honey is described as being very dark and non-granulating. Beyond human industry, Cascara Sagrada is a vital component of its native environment. The tree provides a significant food source for wild animals, including bears, foxes, wildcats, sheep, and many bird species. It is particularly important for the deer family, who eat the plant during the winter when other food is scarce. The clinical medicinal uses of Cascara Sagrada are diverse, ranging from its primary role as a gastrointestinal treatment to its applications in supporting metabolic and hepatic health. Historically and in modern practice, it is valued as an intestinal tonic that restores normal elasticity and tone to the bowel muscles rather than acting as a harsh, one-time purgative. The most well-documented use for Cascara Sagrada is the treatment of chronic constipation in both children and adults. It is considered particularly suited for delicate and elderly patients because of its mild action on the large intestine. Unlike many laxatives, it stimulates the autonomic nervous system to increase natural peristaltic action, the worm-like movement of the intestines, helping the bowels eventually function regularly on their own. It is used to produce large, soft, and painless stools, which is clinically beneficial for patients suffering from hemorrhoids or those requiring stool softening before anorectal surgical procedures. It is also used to prepare patients for radiological or colonoscopic procedure by clearing the intestinal tract. Cascara Sagrada is indicated for use in cases of dyspepsia, indigestion, mucus colitis, torpor of the colon, and constipation. Cascara Sagrada is considered highly beneficial for the liver and gallbladder. It increases the flow of bile and has been used to treat gallstones and liver complaints, including enlarged liver, jaundice, and cirrhosis. It increases secretions from the stomach, liver, and pancreas. Because it activates pancreatic juices, it is sometimes used as a support for diabetes. While primarily a digestive aid, there are several secondary clinical applications. It has been used to treat chronic gout, rheumatism, and cardiac asthma. The plant has been used for sick headaches and high blood pressure, as well as to expel worms. In small dose, it may relieve the temporary constipation and associated morning sickness of pregnancy, as well as constipation during recovery from illness. In veterinary clinical practice, it is regarded as a premier mild purgative for dogs with chronic constipation, as it does not require increasing doses to remain effective. It is also noted as a preferred option for cats because its specific anthraquinones are not absorbed into the body, bypassing the need for complex metabolic elimination. I have also used Cascara Sagrada in conjunction with other herbs for horses experiencing mild colic or general intestinal sluggishness, especially during the winter when horses eat significantly more dry forage and reduce their water intake. Published research on Cascara Sagrada focuses on its chemical composition, its specific mechanism within the human gut, and emerging potential in the field of oncology. The primary active constituents identified in research are anthraquinone glycosides, including amodin and an allied substance potentially identical to the Frangula amodin found in alder buckthorn. Other compounds discovered in the bark include fats, starch, glucose, volatile odorous oil, malic and tannic acids, and hormone-like oils that promote peristaltic action. Research indicates that Cascara Sagrada is one of the mildest laxatives in the anthraquinone class. Its medicinal effect is not immediate because it requires metabolism by gut bacteria to convert anthrones into their active aglycone forms. This process typically results in a 6 to 10 hour delay in bowel motility. The biochemical action involves stimulating the secretion of water and electrolytes into the large intestine while inhibiting their absorption, possibly through prostaglandin E2 or nitric oxide-mediated mechanisms. Interestingly, unlike some other species, Cascara anthraquinones are not absorbed by the body, which may make them a preferred option for certain animals like cats that struggle to eliminate absorbed compounds. While experimental studies on whole herb extracts are rare, significant research has been conducted on isolated constituents like amodin. Amodin has demonstrated the ability to induce cell death in breast, cervical, hepatoma, and non-small lung cancer cell lines. Plant-based polyphenols like aloe-amodin may help reduce drug resistance to conventional chemotherapeutic agents. To understand how research views this plant, you can think of it as a pro-drug factory. The bark itself contains the raw materials, but it requires the specific worker, your gut bacteria, to process those materials into the active medicine that actually does the work. Research warns that Cascara Sagrada may reduce the intestinal absorption of other drugs by decreasing transit time. Specific concern is noted for antiarrhythmics, cardiac glycosides, corticosteroids, and diuretics due to potential electrolyte disturbances. Because Cascara Sagrada increases intestinal motility, the speed at which material moves through the gut, it can reduce the intestinal absorption of other oral medications. If a drug is moved through the digestive tract too quickly, the body may not have enough time to absorb the full dose. Caution is especially necessary for pharmaceuticals with a narrow therapeutic range, where even a small change in the amount absorbed can be dangerous or render the treatment ineffective. Interestingly, some research suggests that Cascara constituents might actually enhance certain treatments. Plant-based polyphenols like aloe and modin have been shown to potentially reduce drug resistance to conventional chemotherapeutic agents, such as doxorubicin and mitoxantrone, by inhibiting specific inflammatory pathways. However, most of this data comes from studies on isolated ingredients, rather than the whole herb. While Cascara Sagrada is valued as a gentle and effective intestinal tonic, there are a few cautions to be aware of regarding its preparation and duration of use. The most vital caution is that freshly harvested bark must never be used. In its fresh state, the bark contains substances that cause severe nausea, abdominal cramping, vomiting, and excessive thirst. To be medicinally virtuous, the bark must be dried and aged for at least 1 year, though 3 to 6 years is recommended to allow oxidation to make the active principles milder and more effective. While it is considered safer and less habit-forming than many laxatives, prolonged may carry some risks. Habitual long-term use can lead to chronic diarrhea, which causes a dangerous loss of potassium and other electrolytes. Long-term use has been associated with cardiac effect, primarily due to electrolyte abnormalities, protein in the urine, and blood in the urine. Over time, chronic use causes melanosis, a dark pigmentation of the mucous membranes of the colon. Even with aged bark, large doses can cause inflammation of the bowels, colic, and persistent pain. In concluding our look at Cascara Sagrada, it is clear why this sacred bark earned its name from Spanish explorers and remained a cornerstone of both indigenous and modern medicine for centuries. Its journey from the canyons of the Pacific Northwest to becoming the most widely used laxative in the world highlights a plant that is as potent as it is culturally significant. The most vital takeaway for any user is that Cascara Sagrada is not a typical aggressive purgative. Rather, it is an intestinal tonic. By stimulating the autonomic nervous system and promoting natural peristaltic motion, it works to restore the tone and elasticity of the bowel muscles. This makes it uniquely suited for treating chronic conditions because it aims to rehabilitate natural function rather than creating the dependency often seen with harsher stimulants. Thank you for joining me for today's discussion on Cascara Sagrada. Please join me next week for a discussion on catnip. As always, this podcast is for educational purposes only. The information contained in this podcast is not intended or designed to treat, cure, or prevent any illness or disease. This podcast is not designed as a substitute for advice from your medical provider, veterinarian, or other qualified healthcare professional.